For many people, the first signs of chronic obstructive pulmonary disease, or COPD, appear so gradually they are easy to dismiss. A morning cough, some sputum, or a bit of breathlessness when climbing stairs. Over time, however, these seemingly minor symptoms can progress into a serious condition that makes every breath a struggle. COPD affects millions worldwide and is strongly linked to smoking and environmental exposures. Although it cannot be cured, early recognition and proper management can slow its progression, allowing affected individuals to maintain their independence and quality of life. The disease develops due to ongoing exposure to different harmful factors, which cause inflammation in the small airways. This inflammation leads to a gradual narrowing of the airways and increased mucus production. Additionally, the walls between the small air sacs in the lungs, or alveoli, are damaged. Essentially, COPD encompasses both chronic bronchitis and emphysema, with one component often being more prominent than the other. As the disease progresses, scar tissue forms in the lungs, resulting in irreversible damage. As a result of these changes, airflow through the airways is obstructed, which in turn affects gas exchange in the lungs. This can lead to a decrease in oxygen levels and an increase in carbon dioxide levels in the blood. Patients with this condition also face a higher risk of respiratory infections, heart failure, and lung cancer. Smoking is the primary cause of COPD, accounting for approximately 19% of the cases, which is why COPD is often referred as smoker's bronchitis. However, other factors can contribute to the development of the disease, including exposure to various pollutants and gases such as industrial emissions, coal dust, and chemicals. These factors can cause inflammation in the small airways and lead to irreversible lung damage. Additionally, genetic factors can influence both the onset and the progression of the disease. COPD begins gradually, with a prolonged cough that is often more pronounced in the morning, and may involve coughing up whitish, yellowish, or greenish mucus. People affected by the disease typically experience difficulty breathing, which worsens with physical exertion. They may feel as they cannot fully inhale or exhale. As the disease advances, individuals have a reduced ability to tolerate exertion, particularly when engaging in activities that require lifting their arms above shoulder level. In the late stages of the disease, they may only have enough strength to perform basic activities, and this may be accompanied by an increase in the previously mentioned symptoms. Due to lung damage, individuals with COPD are more susceptible to lung infections such as bronchitis and pneumonia, which can further worsen symptoms. This condition is also characterized by episodes of sudden deterioration, which may include increased coughing, a sensation of choking, wheezing in the chest, and bluish lips and fingers. These episodes, known as exacerbations, often occur more frequently if the disease is untreated or if the prescribed therapy is not followed consistently. They are typically triggered by infections and may require emergency medical treatment or hospitalization. To diagnose this condition, the doctor, typically pulmonologist, will perform a comprehensive examination of the patient, focusing on their symptoms, any related medical conditions, and the medications they are currently taking. It is essential to identify whether the patient is an active or former smoker. Before the examination, it is advisable to prepare a list of all medications the patient is taking, including their names and dosages. or to bring the medication containers to the appointment. The diagnosis of COPD primarily relies on a lung function test. The most common test is spirometry, which requires a patient to blow into a device that measures the amount of air inhaled and exhaled, as well as the speed of airflow. If necessary, more advanced tests may be conducted, such as body plethysmography, which measures the gas passage through the respiratory membrane. Additional tests include the 6-minute walk test, which assesses the distance a patient can walk in 6 minutes, and oximetry, which measures the oxygen saturation of hemoglobin in arterial blood. Imaging procedures such as chest X-ray and CT scans of the chest can also be performed. These imaging methods can reveal the presence of emphysema or other factors contributing to the patient's symptoms and help evaluate the potential benefits of surgical treatment. Chest CT scans are also useful for the early detection of lung cancer. Laboratory tests may indicate elevated red blood cells and hemoglobin levels, often due to reduced oxygen concentration in the blood. If sudden exacerbations are triggered by infections, signs of inflammation may also be present. Gas analyses are performed by taking samples of arterial or capillary blood to directly measure oxygen, carbon dioxide, and blood acidity. This information is valuable in assessing the severity of the disease and the intensity of exacerbations. There is currently no definitive cure for COPD, but disease progression can be significantly slowed, particularly through smoking cessation, which remains the most effective intervention. Pharmacological treatment is often required, most commonly in the form of inhaled medications. The choice and number of agents vary. Some patients may achieve adequate control with a single bronchodilator, while others require a combination of 2 or more drugs, such as long-acting bronchodilators and inhaled corticosteroids. In advanced disease, when hypoxemia develops, long-term oxygen therapy may be necessary. The duration and indication depend on the severity of gas exchange impairment. Some patients require supplemental oxygen only during exertion or sleep, whereas others need continuous oxygen support to maintain adequate blood oxygen levels. For selected patients with severe emphysema and marked lung hyperinflation, surgical or interventional approaches may be considered. These include lung volume reduction surgery or, in certain cases, transplantation, both of which aim to improve the function of the remaining lung tissue. Exacerbations of COPD represent acute deteriorations that require prompt recognition and treatment. Mild to moderate episodes can often be managed in the outpatient setting with intensified inhaled therapy and systemic corticosteroids. Because respiratory infections are a common precipitating factor, antibiotics are frequently indicated. Severe exacerbations, however, may necessitate hospitalization, escalation of oxygen therapy, and, in cases of life-threatening respiratory failure, intensive care support, including non-invasive or invasive ventilation. Pulmonary rehabilitation is a cornerstone of comprehensive COPD management and has been shown to provide substantial benefits. It does not directly reverse structural lung damage, but plays a crucial role in improving functional status and overall well-being. Rehabilitation can alleviate symptoms, enhance exercise capacity, decrease the frequency and severity of exacerbations, and reduce hospitalizations. When integrated into a long-term care, it serves as an essential complement to pharmacological treatment. Although COPD is a chronic incurable condition, It can be successfully controlled with appropriate management, adherence to medical advice, smoking cessation, and consistent use of prescribed therapies significantly improve outcomes and slow disease progression. Early recognition offers the best chance to limit long-term damage, but even in advanced stages, effective treatment can stabilize symptoms and preserve quality of life. In contrast, failure to follow therapy or continued exposure to risk factors is associated with poor prognosis. With comprehensive care, many patients are able to remain active and maintain independence. Thanks for watching. If you found this video helpful, consider subscribing to more educational content. Have a great day.